Hi, my name is Tom Chu. My pronouns are he and him. I'm the Making Smoking History Programme Coordinator for LGBT Foundation. I work in partnership with Greater Manchester Health and Social Care Partnership to ensure stop smoking services are fully LGBT inclusive. I'm here to talk to you about the barriers LGBT communities may face in accessing stop smoking and health services, as well as the health inequalities that LGBT people may experience, and also talk about the support that is available. Recent findings from the Office of National Statistics show that LGBT communities have higher rates of smoking. The most significantly affected are LGBT women and bisexual men, 25 to 26% respectively, when compared to heterosexual individuals, who are at a rate of 14 to 16%. We can see that there is a significant jump in numbers there. Unfortunately, very little current research is available that focuses on trans individuals and smoking habits. However, it is thought that trans communities are just as affected, if not higher. But how does your sexual orientation or gender identity relate to smoking behaviours? The presence of microaggressions and minority stress directed at and within LGBT communities is linked to higher smoking statistics. This can help to inform us why people may smoke and what brought them to smoking. Trying to access services is an ongoing problem for trans people. A report into transgender equality concluded that services are letting down transgender communities, noting a lack of staff training and failures to combat transphobia. This can lead to trans people being shut out from services and relapsing in their quit smoking attempts, as well as continuing to fuel the cycle of segregation and transphobia. Mental health illnesses are linked to smoking, and those that have mental health issues are significantly higher smoking rates, especially within the LGBT community. A report by Action on Smoking and Health and LGBT Foundation found over half of those surveyed stated they experienced depression in the last year. This is also reflected in a recent LGBT patient survey that found a shocking 80% of trans people experience anxiety before a medical appointment, due to fears of insensitivity, misgendering, and discrimination. From this, we can see that there are potential links to mental health, barriers to accessing health services, and smoking behaviours. Homelessness is also more prevalent within these communities and has links to high rates of smoking. Often smoking is seen as a coping mechanism for significant stress and the addictive nature of nicotine, and the smoking behaviours can mean that a complex mix of factors is created which are hard to break from. Smoking is a big risk factor during and after surgery. Smokers are 30% more likely to die after surgery, and it is recommended that prior to any surgery, individuals stop smoking in order to ensure effective healing rates. Those who undertake gender reassignment surgery are recommended to quit smoking due to the risk it poses to post-surgery recovery. The positive effects of stopping smoking on physical health and mental health are wide-ranging, and some are almost instantaneous. Carbon monoxide levels in your blood are almost halved, around 8 hours after having your last cigarette. And you are 3 times more likely to quit smoking if you use a combined approach to nicotine replacement therapies, such as lozenges or patches, and talking therapies, which NHS Stop Smoking Services recommend. As part of Greater Manchester's campaign to be smoke-free, we are working closely with local authorities and stop smoking services to ensure all programmes are open, welcoming and supportive spaces. We support staff to ensure that they are aware of the health inequalities and barriers that LGBT communities may face in accessing their services, as well as tailoring their support. Staff are provided with the training and tools to have open, honest, non-judgmental conversations about smoking. When the time is right for you, should you choose to quit, there is a wealth of services in Greater Manchester to support you on your journey. For further information, visit the Stop Smoking pages on the LGBT Foundation's website, the Greater Manchester Health Hub, or the NHS Stop Smoking Service helpline for more nationwide support.